This is a tool which is very important and useful for all the sexologists. You may be a urologist, you may be a psychiatrist, you may be a dermatologist, you may be a pathologist, you may be plain MBBS, but we have to have some tool which we can produce a report, or we can tell the patient, or we can screen a patient. Good afternoon, everybody. So before I start with my talk, I'll give a brief introduction, not about myself, but why I entered into field of sexology, because I was a happy dermatologist and was practicing dermatology and venerology very happily. But then in my final year of post-graduation, I attended one conference known as SexCon that was held in Jaipur. I listened to Dr. Theresa, Dr. Raj Brahmbhatt sir, I listened to Dr. T.S.S. Rao, and then my mind changed. So I thought this is very important thing. After that, I forgot about sexology and started practicing dermatology. But then again, patients of venerology, they keep on coming, and while discussing their venerological problems, they keep on discussing their sexology issues. So again, the dilemma started, what should I do? Should I send him to somewhere? Then I thought of sending these patients to some sexologists, but tried finding out, could not find one good qualified sexologist in my whole area. So then I started gathering knowledge, attending various conferences, and then the quest for knowledge increased, and then came the big problem. Patients came to me, I started prescribing medicines, started with SSRIs and many other medicines, learned from my psychiatric friends, I learned from my urology friends. But there came a problem when patient asked, Doc Saab, you didn't perform any test, give me some test results. Some fellow will come and say, Doc Saab, my wife has called me impotent. My in-laws have claimed in dragging me to court. Give me some report which can say that I am potent and I can perform sex. I didn't had any answer. So then I again look forward to my senior people. Again I got the information, yes, you can go and perform penile Doppler test. You can ask for a nocturnal penile tumescence test. I was very happy. Then again I started sending these patients to my radiology friends. And to my disbelief, in spite of being happy that I am sending patients for penile Doppler to them, they started cursing me. They started ignoring my patients, because doing penile Doppler for one patient almost takes around 1 hour, because you need to inject pepaverine, you need to counsel the patient, and then performing itself is difficult. And then 2 or 3 of my patients had an episode of, so you all know what happens then. Urologist reference was done, at some time patient was admitted for 6 to 7 hours in a big setup. A test which was supposed to cost 3,500 to 4,000 rupees landed a cost of around 25,000 rupees. Patient was also very unhappy. I was also unhappy because I lost both the patient, and my radiologist next time would definitely bypass that patient to somebody else. So now coming to the main topic, this is a tool which is very important and useful for all the sexologists. You may be a urologist, you may be a psychiatrist, you may be a dermatologist, you may be a pathologist, you may be plain MBBS, but we have to have some tool which we can produce a report, or we can tell the patient, or we can screen a patient. So coming to the topic again, there are a significant number of men under 40 who experience erectile dysfunction. In the past, vast majority of cases were thought to be psychogenic in nature, but then studies identified organic etiologies in 15 to 72% of men with erectile dysfunction. The organic etiologies included vascular, neurogenic, Peyronie's disease, medication side effects, and endocrinological causes. Much have been said about these. I will be very brief about it. My presentation will last only 10 to 12 minutes. So be patient and try to understand what I am trying to say. Vascular causes are commonly due to focal arterial occlusive diseases. Medications cause erectile dysfunction include antidepressants, NSAIDs, finasteride. Hormonal sources are uncommon in the young population. However, possible etiologies are Klinefelter's, congenital hypogonadism, and acquired hypogonadotropic hypogonadism. The workup of young men with ED should include a thorough history and physical examination. That everybody knows. Our hands are the best palpable instruments, somebody said in the morning, right? Yes, they are. You have palpated, you have understood. Have you documented it? Can you write it? You can write it. By examination, it looks normal, but patient wants report. We are again hand-bound. We have to send it to a radiologist for penile Doppler. So the significant prevalence of vascular etiologies of erectile dysfunction in young men should prompt consideration of nocturnal penile tumescence testing and penile Doppler ultrasound. Penile Doppler ultrasound, you can send a patient to radiologist. If he is a good friend of yours, he may oblige you. But the problem comes with NPT. NPT needs proper setup and it's a time consuming, it needs around 8 hours of at least testing in a lab or at home setup where a patient lies down and sleep with a NPT device attached to its thigh and a ring around its penis. And penile Doppler needs papaverine injection to be given in penis, which can be sometimes painful and cause priapism. Obviously, you need a special ultrasound training and PNDT permission, and it cannot be performed by a sexologist in its own clinic. You will not be able to do it because PNDT will not allow it. Now, the problem comes that this you cannot bypass. PNDT certification you cannot bypass. So, purchasing even an ultrasound machine and learning ultrasound also won't solve the problem. Then what is the solution? This is the solution. What is this machine? This machine is basically adopting it adopts a technology which detects penile vascular lesions. It consists of a computer, blood flow Doppler analysis software, Doppler control motherboard and a Doppler probe. Visually, it reflects the blood flow velocity of the penis and calculate the penile blood flow index according to the blood flow velocity value. Now, some people will say that yes, we have seen gynecologists using Doppler, fetal Doppler. They also do it, fetal Doppler, for doing a test while assessing that fetal is in distress or not. No, this is very different because that fetal Doppler, if you have seen, it got a very big probe. The mouth of that probe is very big. It is not sensitive enough to catch the waveforms of these arteries, which are very, very small. So, advantages of this test is it is much easier to perform, does not require any special training or license, and it can be performed in privacy by sexologists in their own clinic. Here is a demonstration video. We'll just start the video. Please watch it. It's a 2 minutes video. We start by exposing the patient and making him lie down comfortably in our clinic setup. I have made this. We have a sexology lab at our hospital, and this is where I work. We adjust all the parameters. We have to input the IIEF parameters into this software, and then I make patient comfortable, keep on engaging him so that he does not feel awkward. For this, I have taken consent also from the patient for producing this video in this conference. And what I have done is I have adjusted the sound volume because we are working in a chamber which is not free of sound. Your air condition is also working. So we have to increase the Doppler sound so that I can hear it. Then we take the radial artery as a reference artery for waveform. So the first wave which we will be mapping on the chart is radial artery because that is our reference value. So after taking reference value, we first move on to the dorsal artery. Then after doing dorsal deep penile artery, we move to left-sided cavernosal artery and right-sided cavernosal artery. And the process is slightly difficult because you are blind. You have to use your ears and you have to achieve that capacity where you can fix your hand while you hear the pulsations. Because if you can visualize anything, to fix it is very easy, but you have to listen and fix it. And since we are not very good listeners, these days we don't have the patience to listen, you have to develop a lot of patience in this particular method. Although it is not very difficult to achieve, but you need a lot of patience. So patient while lying down will definitely be asking you questions, Doctor Sahab, ab kya ho raha hai? Meri report kaisi kharab aa rahi hai? So you have to keep him also quiet because if he is also talking, you will miss the sound, right? So we are charting, the video quality is I think visible to all. Here the charting is coming. How you know that you have reached the artery? The regular waveform will come. Whenever you have the regular waveform, there is a foot switch, you push it and it will record it. So this is how the procedure is done. Now this is the kind of report which will be produced. You can see this report has IIEF value being written here, which we have talked to the patient, asked about it, and then we have recorded it here. This is the PFI value, which is the calculation which comes after the completion of this procedure. These are the IIEF sheet. IIEF sheet is being given along with this so that we can corroborate or report with authentic data. And these are the waveforms, actual waveforms of the patient which we have achieved. So after that you can sign it and give it to the patient that this is the data, and you can very well get it checked. This machine is under the process of getting the patent. It was filed in 2011. It's still under the process, and I think there is some technical difficulties because of which they are not able to get it. What is the calculation basis? Now PFI, peak flow impedance value, will calculate computing formula using PFI is equal to R divided by A plus B1 plus B2 divided by 3. So R is the radial artery speed, the radial artery flow, and then this A is the deep dorsal artery, then B1 and B2 are cavernosal arteries. So this reference value is normal less than 6. That means the penile flow index is normal and patient does not have vasculogenic problem. If this PFI value is more than 6, it indicates that it is having a vascular lesion. So then you can obviously screen this patient and tell him that you should go and get a treatment for vasculogenic erectile dysfunction. Now we are using this machine for last 1 year in the hospital and have performed 52 penile Doppler till date, and we have successfully detected 12 cases. Mind it, we detected 12 cases, then I confirmed it with the normal Doppler by sending it to a radiologist, and then only I was sure that yes, this machine is working, because otherwise it would have been very difficult to say. So we treated those patients with medicinal treatment, extracorporeal shockwave and other treatment modalities, and this machine can prove to be a useful tool for sexologists. It's a cost effective, time saving, more reassuring for patient. Patient is happy that my sexologist is doing all the thing and he's doing everything in the privacy of his own clinic. And this can help sexologists screen vasculogenic ED in time and treat them accordingly. So the main point is, you who is being trusted by your patient will be performing the whole procedure. And now I am finished with the machine description. These are other equipments which we are using in our setup. This is a male sexual dysfunction therapy machine. This is a suction kind of device, but here's a catch. It does not have a ring and it simulates the normal sexual cycle. It gives the process of normal sexual alternated waves, and this is the electrophysiological stimulation machine which is also present as component of this machine. So these are the equipments we use in treatment of premature ejaculation, Dhat syndrome and erectile dysfunction as well. This is our NPT detector. This is an NPT device, and this NPT device we are using by admitting the patient overnight in the hospital and then telling them that by the morning your chart will be ready and we'll produce it. So with this I finish my talk. Thank you very much. There is a brief history of sexology. As you can see, even the Alfred Chance Kinsey, who is the father of modern sexology, he was not a sexologist or a doctor. So innovation and new things can be brought into medicine by non-medicos also. And we being medicos should respect and try to consider every new thing as an opportunity. So we should try it, test it, examine it, and if it is found to be useful and of great importance, we should all try to accept it. Thank you very much. Thanks for your patient listening.
What is the cost of this machine?
This machine costs around 7.5 lakhs.
And what is the cost of NPT machine?
NPT machine costs around 3 lakhs. This machine is basically a screening tool. If you are getting a PFI value of less than 6, you can very well satisfy yourself with sending it for a penile Doppler. But I have sent already those patients. I found the exact results. Even I got their flaccid state penile Doppler done. I got the value less than 10 centimeter. I got their papaverine injected Doppler done. Again, these results were same. There was no difference.
That's why this is only to satisfy the patient, or can we document this?
We can document this.
We can do same office internal test to identify these patients, no, which.
Sir, we can document this, we can give this report. I am giving these reports, I am documenting. Yes, I am documenting and I am giving the report. Because it is a valid machine.
Do you inject peppermint?
No, no injection of pepperine is required.
Just flaccid?
That's flaccid state.
What is the rules regulation regarding the PCB and DT for this machine?
No rule regulation applies to this as it is not an ultrasound machine.
Okay, thank you.
Sir, one.
How much you charge for this per patient?
So where does it come from? Who is
Yeah,
asking?
I'm
Sorry.
here.
Yeah,
How much you charge?
2,500 rupees per session, per scan.
Per scan.
Yes,
Thank you.
one scan is required for a patient. We can do a scan after 2 or 3 months to see the improvement in PFI.
See, what range you decide for declaring when patient asks for the certificate, whether I am important, or you want to document in front of court also, so
Yes.
many patients they require. So what are the guidelines for that?
Sir, guidelines, they do not exist right now. If you are in a court of law and if there is a question of potency, you also must be knowing there is always a medical board formed. But if a patient asks me, doctor, how can you be sure that I am not having this kind of problem? This is the answer. I have this machine, I am doing your test, authenticated test, well proven. Already a research paper has been published, not in India obviously. You can show them and you can put it forward, no problem.
I invite Dr. Ratlani sir to felicitate Dr. Varun Tyagi sir.